Welcome to our wellness video today, and today we are going to discuss breast cancer and breast lumps. With breast cancer and lumps, we are going to have two types. We have the first type is benign, and the second type is malignant. The difference between benign and malignant is benign type is non-invasive and does not metastasize, whereas with the malignant ones they are invasive and there is chances of metastatizing. The word metastasize means that simply it can spread to other parts of the body. Now with breast lumps, we have the things that we look at to say if these breast lumps to describe the breast lumps that we are going to be having. One, we start with duration since onset. Second, we need to know the shape of the breast mass. Then we need to know the texture. Is it soft or hard? Then we need to know also about the margins. Are they is the mass well differentiated with the margins, or you cannot locate all the margins of the lump? Then is it fixed or it is mobile? Then we also need to know the location of the mass. With the location of the mass, we give it based on from where the nipple is. So we use it like a clock, 12, 6, then the other parts. So we give it in distance like 4 centimeters from the nipple, 3 o'clock. So we also need to know whether these masses are associated with discharge or not. Then we need to know if there are nipple changes or not. And when we talk of nipple changes, we have either the nipple might be either change in color, change in shape, or texture. Now we also need to know whether one has had a history of breastfeeding, because for those mothers who are breastfeeding, we know there are masses that will develop and might be associated with breastfeeding. And yeah, so again we need to know if there is associated lymphadenopathy, and for lymphadenopathy we check axillary lymph nodes to see if there is any lymphadenopathy. Then we also need to know if there are any other clinical features when you are presenting your history. That is, are we having weight loss or another clinical features which might suggest something to do with cancer. So with breast cancer, one of the most important things in diagnosing or making to deduce a breast mass or cancer is breast examination, and we do quite want to encourage people and ladies to do breast examination, self breast examination daily whenever they're taking their showers. And when you're doing your breast examination, I'll elaborate how you need to do it. This is your breast, and whenever you're examining your breast, you need to have your palm aspect, not your fingers tips. If you do it with your fingertips, it's wrong. You do it with your palm. So you divide your breast 4 times into 4 portions as indicated, and with the 4 portions you examine one part at a time. So you start with this part, you palpate deep, then this other part you palpate, then this part you palpate, then the last part you palpate, and you can feel from the nipple if there are any masses. If you feel anything that is touching your palm, then most likely it's a mass. So if you are getting any masses, you can go to hospital, let it get checked, and we'll get to know what type of mass we are having. And now when you go to the hospital, the same process will be repeated. Examination will be done, history taken, examination done, then we might get to investigations, or you might be given an advice even without any investigations. But the important investigations for us to get to know whether one is having breast cancer or what kind of masses one has developed. Number one is the breast ultrasound for mothers, for other women who are above maybe the age of 40-45. We do a breast mammogram instead of breast ultrasound. Then after you do imaging, the image tells us what they are able to see, what kind of mass they are able to see. Then after that, now we might decide to do a fine needle aspiration, whereby we get cells from the mass, and those cells are sent to the pathologist to get to tell us what kind of masses we are developing. Also, in other instances, we might need to do excision. We excise the mass, then we have histology for the mass. For breasts that we are getting fluid discharge, we also get the fluid for histology. So treatment modalities we also will depend to the diagnosis. For the benign masses, one, we might not need to remove all of them. There are those ones that we are not going to remove, but if they are giving discomfort, they are giving pain, or affecting the patient, then for those masses we might need to excise, if excision is the modality of treatment, and that is surgical. With the ones that are malignant, we have chemotherapy, radiotherapy, and surgery. And the last part is mastectomy. So breast cancer, notice it early, let it get to be handled early. It is treatable, it is curable, and you're going to be okay. Thank you for listening to us. Subscribe.